God, what a surprise. I didn't see you there. Welcome to PV's Women's Hospital at the L&D unit. My name is Samara Jones and I'll be the nurse today. Yes, we're gonna follow, you're gonna follow me to my patient's room. Today I have Miss Javier. She was brought in for an induction of labor. So we're gonna go in, introduce ourselves, and do a quick assessment. Come on, let's start our day.
Well, come in.
Hello, good evening.
Good evening.
Hi, my name is Samara Jones and I'll be your nurse today. Is everything okay? How are you feeling?
I'm good.
You're good? Yes. Oh, it's quite dark in here, but okay. Is this your husband?
Yes, he is.
Hello, Mr. Javier. My name is Samara Jones. I'll be the nurse today.
Shalom. Shalom.
Okay. Just as a routine, at the beginning of every shift, we're to do an assessment. So, if you don't mind, excuse me, Mr. Javier, could you please turn on the light, please? Okay. I guess I'll just try to reach around here. Okay. That's better. Okay. So, let's see. Let me start off with sterile gloves. So, are you all excited?
Yes, we are.
You are. Have you thought of any names?
Names? No.
No names?
No.
Okay. Well, I guess you all will determine. I'm guessing you all will determine that once the baby is born. Okay. 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 Gonna do. Oh. Let's see, Mr. Javier, could you please remove the blanket from your wife, please? I have to do a check on her and it has to be sterile, so I'm not able to touch anything. Okay. Guess I'll just start all over. Fresh pair of gloves. Okay. If you could bend your knees. Okay. All right. All right, so you're gonna feel a little discomfort, okay? Oh, okay, you're coming along beautifully. You're dilated 7 centimeters and you're 100% effaced, okay? So you're almost there. Good job. Okay. So, is there anything that I could do for you?
No, thank you.
Are you sure? You look a bit dehydrated. Are you sure I can't get you anything?
Water will do.
Okay, well, I can't give you too much water, but would ice chips do?
Oh, yes, it will.
Okay, well, I'll be right back with that, okay?
Water, thank you.
Very strange bunch. He's not interacting with me, and I don't know what's going on. I guess maybe her husband is a bit standoffish. Maybe he doesn't want to talk to me. Maybe he doesn't want to interact with her because she's in the room. Hopefully, by the time the birth occurs, we'll see a bit more interaction with him. Okay. Hi, welcome back. Okay, so my patient, she gave birth to a healthy baby boy, 8 pounds, 1 ounce. And so now we're gonna go back in. I imagine that she's hungry. I think she mentioned something about it. She's very tired. So we're gonna go and check on her and bring food. Hello, Miss Javier. Hello, Miss Javier. Oh, look at your beautiful baby boy. How are you feeling?
I'm doing great.
Great. Okay, I brought you some food, so because I know you might be hungry right about this time. So
Let me hold the baby.
I'm gonna. Oh. Oh. Okay. There you go. I'll pick that up for you.
I'm sorry.
There you go. It'll be okay. So we're getting ready to discharge. We're gonna start preparing to discharge you. And in order to discharge you, we need a name for the birth certificate. So have you all finally decided on the name?
No, we did not. Sorry.
Oh, well, in order to discharge you, we need to have a name for the birth certificate. And without that, we are not able to.
I'm sorry, we did not prepare any names, and it's not my problem right now.
It's not your problem that you, okay.
We did not prepare the name. I'm sorry.
All right. Well, I'll go speak to the charge nurse and see what we could possibly do to accommodate.
Oh, thank you. You do that. Thank you.
Why do you not have a name for your baby? That's strange and odd. I've never encountered such an interaction with my patients. This has been a trying day, but hopefully we can find a solution with the charge nurse and we can discharge our patients. Marsha, you would not believe the day I had.
What's going on? What happened?
My patient, it's just been a very, very weird interaction with them today. When I first entered the room, it was very dark, and I introduced myself to both the wife and the husband, but the husband didn't reciprocate, the welcome. He kind of ignored me, and he kept reading this book like it was, I don't know. And then I asked him, when I tried to do the assessment, I asked him, hey, excuse me, could you please turn on the light? It was right near him. Like, okay. This is him, this is the light. All you have to do is go, Finally, I had to go around and reach, behind her just to flick it on. And then I couldn't even get him to help me lift the blanket after I put on my sterile gloves. So she gave birth to the baby, and she mentioned earlier that she didn't have a name, but I figured, okay, you might have a name you might have, decided to name the baby once the baby was born. But when I talked to her about discharging, nothing still. And I brought her food afterwards because I knew she would be hungry, and she didn't touch it.
That's interesting. Alright, let's go check out your patient. I want to see this patient face to face.
Okay.
Okay. Do you have the chart there or at the bedside?
Yes.
Okay. Alright, we'll go there.
Yes, come in.
Hello, Mr. Javier. Congratulations on the baby.
Thank you.
How are you doing? You feeling okay?
I am doing great.
Have we been taking care of you well?
Yes, thank you.
Okay. Alright. My nurse tells me you didn't eat your food.
Yes.
see.
I'm waiting for my family to bring me kosher food.
Oh, okay. So you're Jewish?
Yes, we are.
Okay, okay. Give me 1 minute. Let me speak to my nurse and I'll be back, okay?
Sure.
Alright,
Thank
just
you.
gonna take your shirt as well. Alright, let me speak to the outside. Okay. So,
See?
do you see the problem?
No, I don't. What? I don't see it.
Okay, your patients were not the problem. Your care was actually the problem because you didn't provide cultural care to them. You provided care as if you would provide it to any patient from your culture, from your perspective. Your client, your patient is Jewish.
She's Jewish.
Didn't you just hear her saying that?
Okay, but her husband wasn't wearing like the little hat, and her husband wasn't. He didn't have a long beard or the sideburns. How was I supposed to know?
Okay, stop it right there. I'm gonna say this to you before you go out there. Say it in front of them and get us all in trouble. That is stereotyping. That is not correct. Just because they didn't have that, you're supposed to assess your patient. It's even in the chart. Let me show you the chart. It's right there. See, all you had to do was read your charts properly. It says religion Jewish, preferred language English, diet kosher diet. And in kosher diet, you cannot provide meat and milk together. You cannot serve that. That's why your patient didn't eat it. Not because she did not want to eat, but because the food you gave her is forbidden in her culture. So you need to be able to understand the Jewish culture and be able to provide cultural care properly. And you also do not get to be frustrated because these patients are the ones that are sick. You are there to take care of them, not the other way around. Okay? So, today it's over. At least she had her baby. Everything is healthy. So I will go talk to her, and hopefully everything will be okay. But for next time, when you're taking care of a Jewish woman or any other culture, you need to be aware of the specific laws or what they do, like the specific norms that they have. So for Jewish people, I want you to understand what the Sabbath law means.
Okay.
Because that clearly played a factor in today's incident, what happened with you throughout the day.
So Sabbath occurs on a Saturday?
Yes,
Okay.
that is a Jewish. In the Christian world, it's usually Sunday. That's what they consider the Sabbath.
Right.
But for Jewish, it's Saturday, and they cannot do no work on a Saturday.
That
That includes the light.
turning on the light.
Exactly.
Okay.
And also, you said the husband didn't even say hi to you.
Mm-hmm.
You don't know what the cultural norm is. So you need to understand what they consider as normal, what's modest for them. So you need to look up their modesty laws, their food, obviously, since you messed up and you gave her an unclean food for them. You need to understand the laws. And also, you need to understand what the laws of their namings are. Because not every culture will have a name picked out. Okay? So that's your assignment. You need to figure it out, and then you need to report to me by the next shift. So next time around, I can trust you. Because right now, you're not doing a good job. And you're making us and the unit look bad. And PV does not produce bad nurses.